Good evening, doctors. Welcome again. Our today's topic is PID. It's pelvic inflammatory disease. Is an infection of a female reproductive organs. It usually occurs when the sexually transmitted bacteria spread from your vagina to your uterus, fallopian tubes, or ovaries. Pelvic inflammatory disease often causes no signs and symptoms. As a result, you might not realize you have the condition and get needed treatment. The condition might be detected later if you have trouble getting pregnant or if you develop chronic pelvic pain. Okay. Pelvic inflammatory disease. First is bacteria may enter through vagina and with semen. Second one is bacteria may passes through the cervix and enter the uterus. Third one is bacteria enters the fallopian tubes and ovaries which can become infected. And fourth one is infection can leave fallopian tube and spread to the other parts of body. Okay. Symptoms include swollen fallopian tube, scar tissue, infection, fatigue and pelvic pain as you see in a picture now. Signs and symptoms include pain in a lower abdomen and pelvis, heavy vaginal discharge with an unpleasant odor, abnormal uterine bleeding, especially during or after intercourse or between menstrual cycles, pain or bleeding during intercourse, fever sometimes with chills, painful, difficult urination. PID might cause only mild signs and symptoms or none at all, when severe PID might causes fever, chills, severe lower abdominal, pelvic pain, especially during a pelvic exam and bowel discomfort. Causes. Many type of bacteria can cause PID, but gonorrhea or chlamydia infection are the most common. These bacteria are usually acquired during unprotected sex. Less commonly, bacteria can enter your reproductive tract anytime the normal barrier created by the cervix is disturbed. This can happen after childbirth, miscarriage, or abortion. Risk factors includes being a sexually active woman younger than 25-year-old, having multiple sexual partners, being in sexual relationship with a person who has more than one sex partner, having sex without a condom, touching regularly with upsets balance of good versus harmful bacteria in the vagina and might mask symptoms. Having a history of PID or sexual transmitted infection. Most experts now agree that having an intrauterine device insert does not increase the risk of PID. Any potential risk is generally within the first 3 weeks after insertion. Complications. Untreated PID disease might cause scar tissue. Other complications includes ectopic pregnancy. As you see, PID is a major cause of tubal ectopic pregnancy. In ectopic pregnancy, the scar tissue from PID prevents the fertilized egg from making its way through the fallopian tube to implant in the uterus. Ectopic pregnancies can cause massive life-threatening bleeding and require emergency medication attenuation. Infertility. PID might damage your reproductive organs and cause infertility, the inability to become pregnant. The more times you have PID, the greater your risk of infertility. Delaying treatment for PID also dramatically increases your risk of infertility. Chronic pelvic pain. Pelvic inflammatory disease can cause pelvic pain that might last for months or years. Scarring in your fallopian tubes and other pelvic organs can cause pain during intercourse, ovulation. Tubo-ovarian abscess, its PID might cause an abscess, a collect of pus to form in your uterine tube and ovaries. If the left untreated, you could develop a life-threatening infection. Prevention. To reduce your risk of PID, practice safe sex. Use condoms every time you have sex. Limit your number of partners and ask about a potential partner's sexual history. Talk to your doctor about contraceptions. Many forms of contraception do not protect against the development of PID. Using barriers methods such as condoms might help to reduce your risk. Even if you take a birth control pill, it is still important to use condom every time you have sex to protect against STIs. Get tested if you are risk on STIs such as chlamydia. Make appointment with your doctor for testing. Set a regular screening schedule with your doctor if you need it. Early treatment of STI gives you the best chance of avoiding PID. Request that your partner be tested if you have pelvic disease, PID, STDs. Partners to be tested if necessary treated. This can prevent the spread of STIs, possible recurrence PID. Don't Dutching. Dutching upsets the balance of bacteria in your vagina. Diagnosis by the exam of signs, symptoms, pelvic exam, analysis, vaginal discharge, cervical cultures, urine test. During pelvic exam, doctor must see the swab samples and vagina and cervix samples, analyze, determine the organism causing the infections. Confirmation by blood and urine test. These tests measure your white blood cell counts, might indicate an infection, and markers that suggest inflammation. Your doctor also might recommend a test for HIV and sexually transmitted infection, which are sometimes associated with PID. Ultrasound. This test uses sound waves to create images of your reproductive organs. Laparoscopy. During his procedure, the doctor inserted a thin lighted instrument through a small incision in your abdomen to view your pelvic organs. Treatment. Treatment includes antibiotics for different bacteria, and treatment of your partner also. Temporary abstinence means avoid sexual intercourse until treatment is completed and test indicated that the infection has cleared in all partners. Most women with PID just need outpatient treatment. However, if seriously ill, pregnant, haven't responded to oral medication, you might need hospitalization. You might receive intravenous antibiotics you take by mouth. Surgery is rarely necessary. However, abscess ruptures threatens to rupture, your doctor might drain it, and if you don't respond to antibiotic, treatment is questionable. Diagnosis such as one or more signs of symptoms of PID or absence. So guys, I hope it's clear for you till here. Have a good day, goodbye, and I hope this concept about the PID is clear for you. If you have any queries, any question, you can ask me regarding this disease, and this is a group of disease, chlamydia and lot of diseases. So guys, have a good day, goodbye, thank you. That's all for today.